parent should have to go through the heartache of losing a child needlessly. My daughter, Shalynne, was a very funny, loving, and determined young woman. She had just driven from Kansas City to Las Vegas to complete her schooling to become an RN. She worked 2 jobs as a CNA and was in the waiting period for health insurance. In June of 2015, she fell and went to the ER in excruciating pain with a red, swollen leg. The staff immediately asked if she had insurance. Unfortunately, Shalynne mistakenly replied no, thinking her employer-provided insurance had already been terminated. And with that, her fate was sealed. She begged for an MRI and medications to treat her 8 out of 10 pain, to no avail. They told her, "Go get insurance and see a specialist. We're not a doctor's office." If we had Medicare for All, insurance would not have had an impact on Shalynne's care. Her doctors would have asked the important questions and treated her pain. They'd known that, in addition to her red and swollen leg, she was half African American, taking birth control, had sickle cell trait, and she had just completed a 22-hour drive on an injured knee. All of these are risk factors for a blood clot. But because a basic screening wasn't done, no one was able to uncover the clot that had been forming in her leg. Having a blood clot while flying is life-threatening. And on June 25th, Shalynne took a flight back to Kansas City. The blood clot broke off in her leg and caused a massive pulmonary embolism. The next morning, her father called and said Shalynne had woken up with severe chest pain. She coded in the ambulance. It took 59 minutes to stabilize her. When I finally saw my daughter, she was intubated and hemorrhaging. She never regained consciousness. And when the time came for her organ donation, they removed breathing tubes, and I held her as she took her last breaths. Shalynne didn't have to die. I cannot remain silent, knowing that thousands of other families continue to experience the immense pain that I'm living through under our current profit-driven healthcare system. Healthcare is a human right, and denying it to those in need is inhumane. Now is the time to be politically involved. We need to tell our stories and put a face to the fight for Medicare for All.